Yes, good afternoon to everyone.
Good afternoon, sir.
Yes, sir. So now we'll continue quickly. So you are left with only 50 plus. So then single remedy, OT remedies. We are covering the OT remedies. Organ OT means in the seven volumes of Mataji, you will find referred as a OT remedy. OT remedy is organ therapy. Okay, organ therapy remedy. Skin. For skin means so any for any problem of the skin it can be used, right? So red spot, that spot, varicose veins, where you want skin grafting, when you want to tone up the skin, that time you can use the skin of the skin OT. Number 528, spleen. Spleen is believed to manufacture the blood. You can say means it controls the blood hemoglobin level. Is there are so many organs in our body, still we are not sure what it is doing it, because altogether, because even spleen is removed for many people, but they have to still they're surviving. Likewise, so it is generally blood chemistry, you can say, but it enlarges whenever there is a malaria or you can say jaundice. In that time, along with the liver, it also spleen also gets enlarges. Stomach, also all the problems of the stomach, and the adrenal gland for high blood pressure. Sympathetic nervous system, sympathetic nervous system, involuntary muscles. Involuntary muscles means those glands function automatically. And synovial tissue, where the synovial tissue is there, that is in the joints. तेल खत्म हो गया बोलते हैं ना, इन योर ले लैंग्वेज. So 531, there is a adrenal gland for high blood pressure, and the sympathetic nervous system for supplies involuntary muscles and gland that functions automatically. And synovial tissue is for arthritis, joint problem. Synovial means what? The joint, within joint बोलते हैं ना ग्रीस खत्म हो गया इन लेमन लैंग्वेज, तो वो वाला ग्रीस जब खत्म हो जाता हो तो साइनोवियल फ्लूइड, साइनोवियल टिश्यू कैन बी यूज्ड. टेस्टिकल्स for all men problem. Okay, thymus gland, single part of the body. Thymus gland is generally used for, I generally seen it in the immune deficiency. Okay, including much, we'll see which one is hyperaction, emotional hatred, rage, and other thing. Indicate too much acid or pepsin. The excessive anxious children, overactive brain. Okay, see, this is very good for, we can say, for the hyperactive children. Next is urethra. Okay, then the constant miscarriage, uterus, all uterus problem, tumor in the uterus. So uterus means all connected to uterus problem can be, we can give this. Fibroid, okay, and cervix and so many, sterility, absence of menstruation. See, all are very important because I know it is very difficult to cure. So we can give this and definitely give a try. Inflammation of vagina, white discharge, that is vagina. Vagina can be used for this white discharge. Veins. Veins is generally varicose veins we can call. And hemorrhoid. So homeopathic remedies again. Adonis where restores the heart wall, increases the urine. Most important is cardiac edema. Means the swelling of the heart. You can say hypertrophy of heart. So the Adonis controls the water. You can say it balances the water. Athusa. It is for, I was telling, this is for the children's diarrhea, not able to tolerate the milk. You see, it is already available. Not digest milk, diarrhea in children. Okay, it's very important. Electris ferronisa. It's a agaricus mus. Mental imbalance, patient talks lot, laughs, eats, great physical strength, loss of sense of size, dizziness, twitching, throbbing. And this is a most wonderful remedy for itching and burning skin, neuralgia. Would you call no? So due to diabetes, you get a feet start burning. Isko that you can call as sensory neuropathy. For that, generally we use this agaricus. Next, Electris ferruinosa is wonderful female remedy. It's called as a female tonic. So, remedy for weak uterus and you strengthen the it for what you call sterility, not able to bear the babies, for them you can definitely give it. It works like a female tonic. And Arum triphalicum is generally for watery discharge. Bratacarb, see, generally Bratacarb can be used for all stunting of mind and body. So one becomes it can be given. It's a wonderful remedy for mental retardness and very good for swollen tonsils and glands. Okay. Next, Cardidus marinus. This is a wonderful remedy. Why we say wonderful remedy? Frequently indicated for liver cirrhosis. This has done a miracle many times. So, main sign liver, gallbladder excess. This much is sufficient. Mainly for liver and gallbladder. Cirrhosis of liver, complaint of liver. anything connected to liver. Colocynth. Colocynth, cramps of abdominal, and even for sciatica. Kundarango, esophagus cancer. Esophagus cancer. Gnaphalinum. Sciatica. Sciatica with numbness. Wherever you sit, that the thigh portion below becomes numb. Geico. This is basically for anyway, the against the scorpion. I will tell you the scorpion bite one more mantra. Okay, you just within 20 seconds that scorpion that stinges, burning, everything goes off within 20 seconds. I myself tested it, not only read in the book. I will tell you. Of course, in Bangalore or main city area, the scorpions are very less. Iris vascularis, pancreas and liver. Jaborandi, very good actually a hair tonic. It's not written here. Okay, I will not. It's for actionally. Is also another name of this also the pilocarpine. Pilocarpinum is one of the remedy and it works on the thyroid, so it cures the hair problem. You can use it as an external hair tonic and it tones the thyroid gland. And next is lac caninum. You know what is lac caninum? If where anywhere you find lac is milk. Milk of can means the dog milk. Dog milk, in homeopathy, everything they are using. Animal kingdom, that mineral and plant kingdom. So this they have patentized lac caninum means dog milk. Most wonderful. I have always used it. Many times I used it for drying up of nursing mother. Milk of a nursing mother means they feed breastfeeding. They discontinue after some days, but still they produce lot of milk. That time, if they are not draining it out, it becomes inflamed and very painful. In such condition, we can give this for drying up the milk. Lilinum tigricum is a wonderful women remedy. Okay, patient depressed and suffers mentally, menstrual problem, feeling uterus being pulled down. You can say, or you can even you can say that the sagging down of the uterus, that is called the hernia. Okay, prolapsus also they can call, means the organ tries to come out, or you can say that is prolapsus of the uterus. And PY, Pyrogenum. Pyrogenum is what? Remedy made from rotten, what you call, say that flesh, rotten flesh, or you can say meat, rotten meat. Why it is required? If a rotten meat, it is used for blood poisoning, or the same thing is happening within our body, it will remove. So you see, patient has a sepsis, wounds, all secretions smell very badly. In such condition, anyway, you no need to get a fear of these things, because we are not using the any rotten, you can say, meat. We are not using it here. We are only using a thought of it. So don't get afraid. We can get the same similar benefit as they get in homeopathy, but purely a vibrational way. Okay, pyrogenal, sepsis, and spongia. Spongia for dry cough. Viburnum. This is a wonderful. This is a female tonic. Used for stopping repeated abortion. Okay, I have used it many times. Female tonic. Cleansing. This is anti-chemotherapy. Side effect of chemotherapy. Miasm, all miasm. Cleans the whole body. Vitamin balance. Alzheimer disease, what is the Alzheimer disease? The loss of memory, gradual loss of memory loss, and insanity due to it is an age related problem. We can say memory loss. Insanity is also not required. Insanity is not so prominent, but memory loss is a prominent Alzheimer disease. And astigmatism. Astigmatism is what? It's an eye disease, not able to focus. Attack of unusual excessive hunger followed by spontaneous voluntary vomiting. Bulimia. I never come across this disease anytime, but if they have written there, they might be facing it. Swelling containing cyst. What is a cyst? Swelling containing a fluid, medium, solid, and together with a single part. See, cyst is there. If ovarian cyst is there, PCOD means what? Polycystic ovarian disorder. PCOD, ovarian disorder or a disease. So it is a cyst only. So how we have to do? Ovaries. Ovaries is there in the one card is there. Ovaries and cyst, they have to be used together. Or you can say in the card you can fix the ovaries and cyst you can set on the knob. Both are available here. You can use the card one after the other. So what they are telling, use the cyst along with that the concerned organ where cyst is there. Fungi pathogenic. all fungal infection. You know where do you find this fungal infection all the time? In the where humidity is more, or near the seashore, where in between the thighs get a lot of itching, moist, and becomes a whitish something, that time whitish, that ash like powder will come. This is like, this is a fungus. So you should take what all, how you cover up fungus pathogenic skin, and the skin itch and skin D, like you can cover up and you can make and recommend and give. Because now only we have come across all the things, no, skin 27 and skin itch and this fungi pathogenic, this can be mixed together and given. Hyperthyroidism means what happens? There will be a weight loss, excessive secretion of thyroid hormone. Means if that is excessive, one person goes thin. I already told you that in allopathic medicine, allopathy, as per my knowledge, because been heard that they burn with a radioactive iodine. Many patients have come to us, so their thyroid is burnt. Then they again treat for hypothyroidism, not for thyroid, hyperthyroid. So that is the thing. But we have done very excellent job in the Tiptur where we used to practice. That girl, that lady become totally all right, now is remaining all right. Okay, she is that thyroid is well balanced, mainly with the Vibronics. And another things also means like other combinations also we have used, but only Vibronic through numbers only. Hypothyroidism. Hypo means weak thyroid gland secretion. Means when weak thing is there, then the persons become fat, obese. For obese person, you see, for obese person, you don't need to see whether his thyroid is low secretion or high secretion. How do you come to know in the thyroid whether it is secreting normal or it is hyper? There is a parameter called thyroid stimulating hormone, TSH. If TSH is between up to 5.5, it terms taken as a normal. If it goes above, means it is stimulating more thyroid. That's why it is a more energy is required to produce the correct amount of thyroxine. For that reason, it is called as hypothyroidism. Okay, very interesting. So likewise, so that time when you don't, what I was telling you, no need to test whether the person, if you are treating obesity, treat obesity, no problem. Obesity with hypothyroidism you can treat, but no need to test whether he has got a hypothyroidism or not. So it balances his thyroid. Definitely there will be imbalance, whether it shows in the report or not. It will be imbalanced. So you must give the hypothyroidism, that card number 568. Leukemia. This is the blood cancer. One sort of blood cancer. There, lack of blood starts coming. They goes back again and again. The hemoglobin level goes down. Multiple sclerosis. You have a card, 570. This condition is nervous system can be manifest a gradual excessive muscle weakness. So we can use along with this, what all we can use? Also as per our guidance, like skeletal muscles, so many things are there. It can be gradual or muscle weakness. This is a very serious condition. Okay, muscular dystrophy. Muscular dystrophy where muscles go deteriorate. Dystrophy means destruction. Destruction. Atrophy is also that is become squeezed as what do you call like a mummified like thing, they become dried. But in the case of dystrophy, it will destroy. You will not find a muscles weakness. Muscle dissolve the muscle. Muscle is and what are the disease of hangover, obesity. Okay, obesity is only there. So 572. You can add this also, and there are so many other suggestion also to cure, to handle the obesity. So food थोड़ा कम खाएगा तो obesity automatic कम हो जाएगा. So osteoporosis, deterioration of the microstructure of the bone. It happens when due to hysterectomy, removal of uterus, all that, tendinitis, ligament injury, excessive physical activity, or any injury. Tetanus, infected soil, cow dung, etc. give such a protection if such injury occurs. Any rusty nail, injury by rusty nail. So it protects from that. Earlier it was there, any bite or anything, they used to give anti-tetanus. Swelling of the growth. Growth means any swelling of the growth and other thing. So for our examination part, you are allowed to refer this. I am saving and I will be sending this. Now I will tell one more this one. See, we will see how to fill up the case record. The case record sheet I'll send you. This will be our case record. Yeah. Yes. See, Vibronic case record. What will be there? So full name of the person, and one more thing is, it is always better to keep a record. So it will help you, because next time whenever the person comes, he says, I'm far better with your remedy. We get confused what I have given to this particular person, then what I have to give next. So likewise, so always use this name, gender, age, date of consultation, contact detail. Generally I always take, so that अगर वो नहीं आते तो फोन करके तो पूछ सकते हैं, पूछना पड़ेगा. पीपल दे आर, आप उसको आई एम फीलिंग बेटर, or you can say 10% I am better, 20% I am better, they will tell like that. Okay, then how to take the complaint means, आप बोलो, you have to ask them, you tell the most worst problem to the other problem. Since our treatment is in holistic in nature, we want every complaint to be taken from him. Be they should not say that first you make this particular thing all right, मेरा पहले ठीक हाथ ठीक कर दो, बाकी सब हम नेक्स्ट टाइम देखेंगे, ऐसा कुछ नहीं. You have to have full picture, full whatever he feeling, complaints. So primary issue, what is the primary issue? Knees pain, for example. Okay, then what else they are having? Sleepless. Okay, then what else? I am just taking an example. Okay, so third point, constipation, we can say acidity. So what next? So let it be, and their main is knees pain. Knees pain, and what else? Breathlessness also we take. At times they become breathless. Okay, so intensity. How is the intensity? We are talking about a main complaint. When intensity is how much? We can say, we will write with a percentage. They say 70% I have got a problem, because they have come up to your place, your healing center. That means they are 30% all right. For that reason only they have come to your place. The triggering factor. What are the triggering factor? Means what causes this severe pain? Means rest. Little bit of rest and they start moving, that gets relieving by MOVE, movements. Okay. Likewise, this will be printed format. You will be taking this, and what are the past illnesses? Anytime they had anything, and past illness, nothing. Okay. So, okay. Yeah, are they under the allopathic or any medication? Homeopathy, allopathy, any any other therapy? We'll remove the vibronics, because we are giving that. Any other? So we let let we say, we then allopathy. We don't need to know what is that, what it is doing. So next is any allergies. Are they allergic to anything? Sometime they say चना. चना को इंग्लिश में क्या बोलते हैं? चना allergy, because all we are talking about the knees pain. So चना allergy बहुत लोगों को रहता है. That is a, you can write, see this why I written like that. It is not for your examination or someone is going to check आपने इंग्लिश का नाम क्यों नहीं लिखा, चना लिखा, nothing. You can even write, if someone, I know I write sometime even in Kannada language also. If I don't get those, some peculiarity they say, so I write that only. Okay, for ragi I don't know. Maybe we can write same thing in English. Okay. How is the mental stress level? We have to either any of these, just we can tick mark. So moderate. Okay. Instead of tick mark, we can highlight here. We are, sleep pattern, poor. We already checked. And mood behavior, anxiety. What is that? Then we say irritability. And daily routine, active, and see sedentary. Sedentary means no more the no more activities and all, we can say generally all city people are sedentary only. Vegetarian, unhealthy diet. So they all people, with knee joint pain and all, will say some people even start with non-vegetarian thinking that it will make their bone strong. Nothing like that. हाथी को क्या खिलाता है? कोई मटन चिकन खिलाता है? So they have very strengthiest body and they घास खाते है ना. Any hereditary diabetes, hypertension, TB, you should ask this because we have a remedy. If someone has these in their family, it will really guide us. So we can give either tuberculinum, carcinosin, or you can say the even carcinosin, tuberculosis, even diabetes also. They say it is arising out of the tubercular miasm. So okay, based on that we can prescribe. Now, very interesting. Now, Narayana mixtures. What is the first Narayana mixture for knee joint? Knee joint is knees only. OM, I think it is 40. What you have to do? We have already that list. You keep that printed list of remedies. Okay, I have called it as a dowsing list also. See, I can minimize here and put that across. List of remedies. Okay. अभी क्या, this I want you people to have this list on your table. Okay. Narayani mixture. Knee joint pain. What are there in the knees? Knees, what knees is made up of? Even bones, right? So NM3. Because now we can, even NM is already written, we can just write 3. NM3. Because we want to, because there is a problem in the bone. If it is due to injury, then you can add NM20 also. Generally will not be. And you see, if there is an extra deposition in the knees, that time you have to use the 21, comma. And see, if you want to detoxify, you can even liver also. But we will not, first level, we will not go so deep. So we will go T24. And I request you people keep this on your table so that you will come to know. If there is a swelling, use a water balance. If there is a knees, if there is a swelling, okay, and what will use? Yeah, their knees pain means there will be a pain in the knees, right? So 59. And what else? Are they very weak? You just see how is there is a stamina. Because lack of vitamin also they may be suffering from this. If that is the case, use 63. If the patient is above 60 years or 65 years, definitely you can give this 63. 63 is backup. It's also called as a booster remedy. Right? Then what else? If there is something worst in their family, somebody's death near and dear, that time you can think of the shock and other thing also. Now gout. If along with that, if there is uric acid level more, if they bring along with them the reports, just have the habit of seeing the reports, whether you understand or not, then make it down. Nowadays that biochemic reports are so smart, they write in the bold letters. Wherever there is a problem, they write in the bold letter, they write it down in the uh, the uh, the remark section of this case record sheet, and we can refer. Yes, the here it is wrong. Like, gout is what? Excess of uric acid level. Excess of uric acid is a gout. So you can say, if generally it is excess due in the knee joint problem. Here we think that it is not there. Otherwise you can add 82 also. Okay, then now is there any infection, inflammation? अगर वो बहुत ज़्यादा उसको, then we can think of it. And sciatica, scar tissue, skin itch, TOPS theme, that's it. I think so. ECAC, Wendell disease, anti-smoking, that's it. Now we have chosen the mixture, Narayani mixture here. Okay. Now then is a OM mixture. OM blood. We have to have a blood, because there will be some problem in the blood. So next is respiratory. There will not be any problem in the respiratory, because we are dealing with the knees. So you see bone I 3, OM 3 also is required, because bone irregularity, any bone problem, it will create that. And you see what else we can be, that is a OM 16 knees only. 16 knees, comma. Then what else? So there is one more thing. Knees alone can't do anything. There are so many the additional things, like connective tissue and supportive tissue. 27 and 30. Okay, likewise you can 27, 30, you can choose. When you choose according to your requirement, that's really great. You feel proud of yourself. Okay, now connective tissue and the supportive tissue. And what else is there in the balance remedy? What is it going to help? Yes, that is only because knees is a part of skeleton. We can write at this particular complaint, we can call 23. Okay, then Soham mixture. See, routinely first we'll go to the real problem, then supportive we can think about later, like divine protection, removal of entity, we can think it later. And we have seen a lot of digestive issue with that person. So because secondary, this is not a main symptom. So for that reason we can write 18. And what else is there? Infection. If that knees is reddish and hot, you just touch the surface of that knees and see. If it is little bit of hot, that means there is an inflammation, infection. So you can assume that, because it will be there generally. So you can say 27. 27 is infection. Okay, and skeletal is very important. Arthritis and skeletal. Pain, arthritis and skeletal. 33, 34 and 36. 33, 34, comma, 36. Okay. Now, see, you should have complete idea. So, what is the What is the remedy for knee pain in the CC combo? CC combo, what is the number? How you can go? Go to the backside, there is a list of index for the diseases. You go and see knees. Knee spelling KNNES. See where is the, what number they have given. Knees, there are so many part in the knee. Knees acute pain. We will take that only, because only for that only they has come to us. So 20.2. 20.2 is the 20.2. Okay. So batch flower and everything, they are covered it. So you can see if you can get some special points on that, you can definitely do. Not necessary that you should cover everything, but why I have listed it here, you should think in that angle. You should think in a batch flower remedies way, not having confidence. They can talk like that. I am afraid. The word they take, I am afraid of so and so. I am not having capacity, or I am not having the confidence. So lack of confidence we can give. And repeated thoughts. They say, when do you get worst? They say repeated thinking. When I am idle, I am not doing anything. That time I sense my pain. That time also you can use the other remedies. And biochemical remedies are, and we have noticed that there is acidity. Natrum phos is for acidity. Natrum phos, natrum sulf. So very good combination for anything. And acupuncture point. See, acupuncture point, I have already sent you a book. You just open that and see what is a single point treatment for the acupuncture point. That is GB34. GB34 is it controls whole muscular issues, muscles issues. So you can use it on the GB34, for example. So it is there. I given you 100 disease, a single point therapy. So you can use that particular point in the acupuncture point. Okay. Then GEMS remedies. GEM remedies. I already told you how to detect it. Okay. I will send you a gem therapy book. It is there with me. You can go through, and for a different diseases, what remedy to be given, it is given here. So I remember gem remedy from knee joint pain is the, what all to be given? Ruby and cat's eye and the sapphire. Here in case of the Bhattacharya, it is a sapphire, means a blue sapphire, not yellow sapphire. Okay. So likewise, how we can write it here? Violet, VIR, IR means cat eye, and red, ruby. So these are the formula for joint pain, any rheumatic pain. Now, remedy and dose instruction. Remedy, now we have seen, we have noted down all these remedy. Okay. So what remedy we are giving? See here, any hereditary disease like that, we have seen the medorinum is a wonderful remedy in the homeopathy by treating any joint problem. Okay. So this remedy selected. What remedy selected? How we selected? We can give all this, NM remedy we have selected, and NM and OM and SM we have selected all this. Okay. Then I will also show you how easily we can do this with the Nada Brahma. And what we have to use? This is mantra 4. I'm going to launch this mantra 5. Okay. Mantra 5. Anyway, I am not connecting the hardware, so the button may not work, but still we can give the demo. Yes. Sairam common combos. We have already designed up to 19.4, and I will assist you. Don't worry. You are going to get this because there is a exe in this. It identifies as a virus. It doesn't mean that there is any virus in my software, because it is a exe, because they say, it says that yes, there is some virus activity. So for that reason, don't worry, you can just go ahead. Now what we thought here, yes, 20.2. 20.2 is already done, but not updated here. I think by evening or just within 2 days, we are going to complete up to the 21.11. That skin, all we are complaining. Just, assuming whatever the digestion tonic, just click it here, and at the background you are going to get all the card number, base 336 number. They come one after the other, and at the last, that it will show that it is completed. So otherwise, if you want to go one by one, we have already seen in our case record what all we have added. So you can see Soham mixture, Narayani mixtures, what all we are adding. Nikshatri, Bonai, just click it here. Like that, we can click whatever there we have mentioned, we can click through that digitally, we can do it. So 3, 21, 24, 30, 59, you can add one by one, so that you add your intention also. Otherwise, just with 20.2, if you add, it take around 5 to 7 minutes. Within that, it completes, it gives all the cards which are mentioned in 20.2 and makes you a wonderful combination. We have seen, practically we have seen, it is helping us, because if anything I make, first I take it, because anything, this is all thought imprinted water, either it will help or not, but we have seen it is helping. So this is how our this case record sheet we are filling. Then next, what is happening, dosage and frequency. You should generally, we give TDS 3 times a day. Okay. Duration of the treatment, this is generally given for 30 days. And the next appointment, you can say whatever today's appointment, you can just, as I told you, I give one free appointment. In between, they can come after 15 days. Just bring that bottle, and what I do, I don't add any water into that again. I just keep that bottle on the that brass disc, and put some more the frequencies or some more intentions. So in that one, if they are fine, no need to, if you are happy with the medication, you say you continue. No, I need some more, I need some more recovery. I need a recovery slow. You can call them, and you can take the same bottle. But if you add water again, it is going to extend for one more month. No, don't do like that, because we need a feedback, not the question of money. We need a sincere feedback. Okay, and also try to record their thing, and for your presentation, case presentation, anywhere someone may ask you this, I will be asking you next future. So you have to bring with your all the what do you call, what, how you are cured and all. We will arrange some award also regarding this. If someone doing very good job, we will give the awards also. Award giving, rewards, it is in a part of our organization's activity. Okay. Next, 30 days. 30 means 30 days. Next appointment date. Patient consent. This is very important. So, very important as per our registration to the government. We have seen this is a drugless therapy. It is not a substitute to the main what do you call, treatment. We have to tell that, because आपने बताया नहीं पहले ऐसा बोलेंगे, लेकिन ये make a habit, say this is a spiritual healing system and you are agreeing to take this. हाँ आपको ठीक है, otherwise you record their voice, keep it very safely. It is no पता नहीं कब कौन हमारा जो है कि someone to trap you, और अगर fix करना ही है ना तो हो जाता है. So for that reason we have to think everybody who is coming to you should take it in a suspicious way. And अगर हमारा खुद का जो काफी दिन से आ रहा है तो they will not ask you anything, but still they know कि we are dealing with Vibronics and आपका certificate will be displayed. उनको दिखाई देना चाहिए. कोई भी आएगा उसका certificate के अंदर very clearly it will be mentioned, and the person is allowed to give intention fill water and the pills like that. It will be written in your certificate itself. So that, and one more point, if this person found to be of good moral and character, no government official can do anything. Like that, it is written in my MOU, that will be written there. Okay. So that is all what I planned in the certificate. So my task is to complete certificates, what you call the layout. You share your suggestion how I can make my this because this is the first time we are making, and we will make through the professional editor. So designer, we are going to do through the professional designer. So what all you want it to be included in the certificate, please share your ideas. Okay, then if I find those are good, okay, I will also discuss with our drugless therapy is a main working committee. Like we have 5 people as on now. So we'll discuss with them and take out their permission, and then we will add those all points. So, but you must give me by tomorrow or day after tomorrow to what all can be added to the certificate. What all you want it to be added to the certificate, like that. Okay. If you are permitted to use your own remedies, you can definitely, it doesn't come under the purview of the Drugless Therapy Foundation. We'll do that. Suppose you have gained many other certificates, or you have some authority to do, sir, like with us, we are very happy to have a very big doctor with us in this first batch. But we don't need to give the explanation for that. So he is voluntarily he is joined with us. So he will be giving we will giving him the certificate. Okay, that's it. So they should know what they are getting. If they have, अगर किसी को शक हो रहा है तो बोलिए उसको, let him bring the honey bottle, but bottle should be round in shape. Don't open the honey bottle that even sealed, let it be remain sealed, and over that only you can put your all the vibration you can give. है ना, ऐसा होता है. Because you should be very careful and nothing is going to happen. But अगर आप you are truthful तो रहेगा ना कि बड़े बड़े डॉक्टर्स लोगों का क्या बोलते हैं, that profession बहुत खराब हो गया because of such people. But we assume that we are all doing good, and what we are doing, it is very transparent. We are doing everything in open, है ना. ठीक है, उतना that's it. मैं कुछ ज़्यादा I don't want to get you afraid before itself. Kuch nahi hoga, and you must say, and we'll see. There are so many we have to follow few steps, because to be safe, आप लोकल लैंग्वेज में आपको लिखा हुआ एक आपको ये भी डालना है, एक इंस्ट्रक्शन, दिस इज अ स्पिरिचुअल हीलिंग। लाइक आपने देखा होगा कि प्राणिक हीलिंग में लिखा हुआ रहता है, a doctor can be a pranic healer, but pranic healer may not be a doctor, like that likha rehta hai. So whatever you're doing, you are understood. By understanding this, I am agreeing to take the pranic healing treatment. So aisa it will be there, so that आपको बैठे बैठे, and even for beginning, or you can say make a habit of taking all the, and sometime what you can do, initially you record their voice and discuss with me. I will give you the hint how you can cover that case. Initially एक medicine बना के दीजिए, you tell them to come after 3 days, so let them come, and then that time you are ready with all the technique and all, ये क्या करना है, how we can give the this one sound, कैसे देना है, नादा ब्रह्मा का sound, how to give them, or likewise we program everything and we make them all right. एक दो बार अगर लोग ठीक होने लगे ना, तो आप मेरे से बात करने के लिए आपके पास टाइम नहीं रहेगा. I wish that should become once आपका you make a like a patent like things. So definitely वो होगा, and I am here to help you, and we will make a definite protocol like that we will do. This is a part of protocol, but is still more added. I will update this case recording also time to time. I'll make in such a way that very easily you will be able to come to a conclusion what to be given. So that's it. But that is my request you, that what you want in the certificate. I will write. This is what all you have learned. What all you have learned, it will be there in the certificate and the back side of the certificate. Or you can say we make a certificate very big size. No problem. You say what you want. Okay, we will do that way. Since we are all doing it in a very organized manner, please give me as early as possible, and this whatever we have marked in yellow, I will circulate just after this to you all, and those who are already attending the now class or not attending, they are going to take this virtually. I will tell them whether they are attended the course, they have seen seen the videos or not. These things we will publish it fast, and also I will tell the only one employee, she will call you and tell that the whatever we have sent the PDF with a yellow marking is going to come, and there is a in our examination no need to mug up and other thing, we can refer and write. I want you all, everyone should score 100 out of 100, or I can say full out of full. Okay, that's it. All the best. Anything you want to talk, share regarding the certificate, please share. And I'm very thankful to all those Sir Ravi Sir, Chandrasekhar Sir, and Isha Madam. They are all very busy in the Sundays, I know, and you give me a sufficient, when you are there, बहुत अच्छा लगता है कि yes, so someone is there with us. So definitely, even Madam also, everybody is very busy people. But this is, we are very coming to the end of our course, and the whatever our question bank is this only, all these cards and marked in yellow only, and that is we'll have 4 choice. You have to just give tuck 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 only. You can refer the books, you can refer whatever it is, and everybody should score 100 out of 100. Okay, and I already told you, we'll see what we can do. Okay, and we have one great person also today called me. They are also working on spiritual level, and they are also stuck. I told we can collaborate and do many more things. Okay, so our future journey will be many more exciting, and I request you all to give your point what you need in the certificate. I will clearly write whatever legal things I have to write in that, little clearly write. Okay, you also should follow that strictly, and when you are following that strictly, nothing will come to your as an obstacle. Okay, we will all be very successful, and thank you for today's class. You all come, and we are completed, and I will update this case taking record again and again. We'll add more things, and we will. I am planning to add the dowsing part of it also. So just with us one case sheet itself, we'll be able to douse and decide which remedy to be given and like that. And thank you so much. It is a beginning, and you will be part of this program forever. As I already told you, in case if any topic, you will be, we will declare it very well in advance in the same group. Whatever the group we have made, if next people are coming, they will be added into the same group. We will announce into the group. If you want to study more about the
Sarji,
kidney and the excretory system, you can join also.
Sarji,
Next,
one more thing.
yes,
Sarji, please come up
yes,
with
madam.
mantras also, na? Talk about the
Definitely, yes.
mantras
There
and the
are there are
shlokas,
many things we left. I told Madam Isha Khanna also
Yeah,
that we are going to do that.
yeah,
As far as our the course is concerned, we are taking this much. Above that also, the learning will be continuous process.
yes,
We will study about the one mantras, and you will try to convert many mantras into the vibration and try to put, because I am very excited. Yesterday, as I told you, so 575710 575710, they repeated 11 times in the glass of water, and water become medicine, and next day morning he was all right. So this, I'm trying to explore new Vedic Vedic mantras, so we can convert them into the number, and then number can be utilized by healing and treating people. So we will continue our journey of healing will continue. I take your point, madam. So we'll see what else to get. And Ishaji also, I will also take that the regarding more application of the vibronic machine. We will definitely discuss, and
yeah.
we will study this. About the vastu part of this. We have left it. We are definitely going to take it in future. But that is because we are approaching the next seventh. Next will be the seventh. I think it is Saturday. So that day we will have the by that time you can call me, and any time before that itself we will discuss, and that question paper I will make along with in the Google sheet, so it will be very easy for you. You can just finish within no time, and you can refer the book. So it is not an because we have to, because when we are referring the patient and looking into this, all these books, and that book, Materia Medica, and all we are allowed to refer. But after referring, are we doing the right decision? That's very important. Okay, so we will see, and just go through this whatever the yellow marked and plus the heading, and everything will be all right. Okay, thank you so much. We will not leave any topic unattended even after the courses, because I am interested to impart my knowledge to everyone. I don't means whatever I know you, some people you have more knowledge than me in some other field. I also request you to say, and you can discuss your, to teach me whatever specialty you have. Like I would like to learn more and more things from you all. Okay, thank you so much. Thank you so much. Today we'll finish up to this time, and uh, then now you are in between the 7 days, but you give me before Tuesday. Wednesday I will be going for the printing, I can say the composing of the certificate. So please give me your suggestion before the Wednesday. Okay, so that I will cover everything. Thank you so much. Thank you. We'll keep updating this. Okay, thank you.
Thank you, sir. Namaste.
Okay, ma'am. Okay, ma'am.